Get faster internet speeds for free when you get TV, internet, and phone. Ask for Trio from Rev.
Join the revolution.
Good evening, Bahamas. Coming up tonight,
the first case of the Zika virus confirmed in the Bahamas. We have the details straight ahead.
Steps the Ministry of Tourism is taking now that one case of Zika is confirmed locally.
Debate on the NHI bill begins in the House of Assembly. That story straight ahead.
Welcome to our news. I'm Christina McNeil. Thanks for joining us. Topping news tonight, health officials today confirming the first case of Zika in the Bahamas. During a press conference at the Ministry of Health this morning, officials said the case occurred in a man who recently traveled to Jamaica. Our Simone Davis joins us in studio with the details. Simone?
Thank you, Christina. Well, since news broke that the first case of Zika virus was confirmed in the Bahamas, this came one day after the first case was confirmed in the Cayman Islands, and several cases were confirmed in nearby Miami, Florida. Health officials revealed that the case occurred in a male resident of Pinewood Gardens. Health Minister Dr. Perry Gomez said the man's symptoms included a rash, fever, joint pains, and a headache, for which he sought medical care at a private medical facility.
A sample of blood was taken for testing and sent to a reference laboratory. A confirmed positive result was received on Tuesday, August 9th, 2016. The patient has been treated for associated symptoms and is recovering.
The Zika virus is transmitted primarily by the bite of an infected mosquito, the same mosquito that transmits dengue, chikungunya, and yellow fever. It can also be passed from a pregnant woman to her fetus or through sexual transmission. Dr. Gomez said his ministry is working with the Department of Environmental Health Services and has heightened surveillance efforts. He also gave these tips to prevent the spread of the virus.
Prevention measures include avoiding mosquito bites by applying mosquito repellents on exposed skin, wearing long-sleeve, light-colored clothing, completely screening all your doors and windows, sleeping under mosquito nets. Other measures include elimination of mosquito breeding sites in and around living spaces.
Consultant to the Ministry of Health, Dr. Percival McNeil, provided ways to prevent contracting the virus through sexual activity.
If you have traveled to an area where the virus is present, they advise women to use protection, and they speak particularly of condom use, for at least 2 months, and males condom use for 6 months.
Dr. McNeil also explained why it is so important for pregnant women to protect themselves from becoming infected.
The Zika virus can harm the developing baby at any stage of pregnancy. In the early stage, in the first 3 months, we know that it can cause the microcephaly, the small brain, the malformed brain, and serious problems, including the eye and everything else. Later on in pregnancy, the baby can die in the womb.
Environmental health officials said they began fogging last night and plan to complete prevention initiatives in 2 weeks. Back to you, Christina.
Thanks, Simone. And as you know, this is a developing story. Well, reacting today, Tourism Minister Obi Wilshcombe says there are steps that must be taken to protect visitors.
We have to have concern because we've seen the impact when the Zika virus, when we heard reports of situations in Florida, we saw that there was some impact on the tourist arrivals there. We have to be concerned. What we're going to do is our team will intensify its communications to the various markets to ensure that the world is aware of how we are handling the situation, that is being properly monitored, and to ensure that at the end of it all, they know that the Bahamas is still a safe and healthy place to come.
Anscombe says news of the Zika virus in Miami has no doubt affected tourism in that area. When it comes to the Bahamas, he believes tourists will understand.
The world is very educated and very sophisticated. People traveling are going to search out where they're going. They're going to seek out information to find out what's happening, and they will look at what's going on in our country. They'll see the numbers. They'll know that just one case at the present time. They'll see what the trends are and how we're managing the situation.
And debate on the National Health Insurance Bill was the focus of the House of Assembly today. And while government officials touted its significance, one MP blasted the bill, calling it nothing more than a political ploy. Jasmine Brown tells us more in this report.
That's right, Christina. The communication by Rollins prompted a back and forth with Prime Minister Perry Christie as both men decided to defend their points of view. Rollins called the National Health Insurance Bill a pack of political promises that offer nothing new to the Bahamian people.
The government's approach to national health insurance now, as it was in 2006 when Mr. Ingram said you were basically rolling out what already existed, you're doing the same now. Because we have primary health care services being provided free of charge in our public health system today. But this, as it was in 2006, is an election eve gimmick to have Bahamians believe that you have delivered on your political campaign promises.
The NHI bill was tabled in the House of Assembly last week. The primary health care phase of the plan will be the first part of the plan to be implemented later this year. But Rollins insists that given what's currently on the table, it appears NHI will not help those with life-threatening diseases. His comments drew a response from Prime Minister Christie, who accused Rollins of trying to confuse the debate.
We don't have to debate whether or not I know what the intention of the government is. And the intention is to have a transition to the benefit package that will come, Mr. Speaker. But at this time, the rollout is based on primary care, where on launching healthy lifestyles in the schools and in the country, Mr. Speaker, all with a view, Mr. Speaker, to lowering the incidence of diseases that people face.
The government has repeatedly said it would fund the primary health care phase of NHI. Rollins says the Christie administration needs to tell the Bahamian people where it's getting the money from.
Where is the provision for the monies necessary to hold on to them? Because, Mr. Speaker, otherwise it's just fluff.
Rollins added that despite years of talk, the PLP has done nothing to make him feel confident in NHI.
The Bahamian people want to know if you're going to talk it, you can deliver what you promise. That's all, Mr. Speaker, because as Mr. Ingram said in 2006, the FNM is supportive of insurance for all. We're not here to say Bahamians ought not have this, but let us know that what you're proposing, you can deliver. If not, this is going to be a basket case that a future government is going to have to come to bail the people of this country out of.
Rollins says in order for anyone to take NHI seriously, the government must be more transparent. Reporting from the House of Assembly for our news, I'm Jasmine Brown.
Thanks, Jasmine. The government will be sticking to its $100 million a-year budget for the primary care phase of NHI. That's according to Health Minister Dr. Perry Gomez, who gave his communication on the National Health Insurance Act of 2016 in the House of Assembly this morning.
We estimate that to provide the primary care NHI benefits package to all eligible beneficiaries, we will need about $100 million per year.
Gomez says that the $100 million price tag will no doubt increase.
This amount will be adjusted each year to reflect increases to the benefits package, the impact of inflation, as well as changes in the demand of health services.
The government made the NHI bill public in February as part of its consultation process, but the implementation of NHI has been delayed several times. In other news, Sandals Royal Bahamian Resorts general manager and financial controller appeared in the magistrate's court today on charges of intimidation and refusal to enter negotiations. Dana Smith reports.
Sandals General Manager Gary Williams and Financial Controller Ronnie Mirza appeared before Magistrate Carol Miesewick. They were charged with failing and or refusing to enter into negotiations with the Bahamas Hotel Maintenance and Allied Workers Union between November 16, 2015 and July 12, 2016. They were further charged with 3 counts of intimidating employees and 3 counts of terminating those same employees. Particulars are that between July 12th and July 20th, Williams and Mirza intentionally and unlawfully intimidated union officials Santino Higgs, the union's assistant treasurer, Latoya Archer, assistant general secretary, and Rhonda Heiler, the secretary general. It is further alleged that on July 20th, Williams and Mirza terminated or caused to be terminated Higgs, Archer, and Heiler. Williams and Mirza pleaded not guilty to all of the charges. They were represented in court by attorneys Jomo Campbell and Clinton Clark. Union officials and supporters crammed the small courtroom in a show of solidarity, and outside the courtroom, they pledged to continue to fight for the rights of workers.
Mirza and Williams were each granted bail in the amount of $5,000 each and will return to court for trial on September 26th and 27th. Reporting for Our News, I'm Dana Smith.
Thanks, Dana. A new appointment to the House of Assembly's Committee on Privilege, and Ariana Vanderpool-Wallace makes her Rio debut.
I really just want to make the Bahamas proud, honestly. We're a small but strong country.
That's coming up when Our News returns.